Hello, I am AARP Vice President Bill Walsh, and I want to welcome you to this important discussion about the coronavirus. Before we begin, if you'd like to hear this live event in Spanish, press *0 on your telephone keypad now.
Escuchar en español, presione asterisco y 0 en su teléfono ahora.
AARP, a nonprofit, nonpartisan member organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. In all states, people 18 and older are now eligible for a vaccine, and access is improving across the country. More than 84% of people aged 65 and older have received at least one dose. While this is encouraging, some people are still struggling with the decision about whether to sign up for a vaccine or not. This comes at a time when new variants of COVID-19 continue to spread, along with misinformation about the virus and the vaccines. In fact, we have seen a proliferation of rumors, outright falsehoods, and scams that have left many Americans wondering whom they should trust in the face of this ongoing public health crisis. This evening, we'll hear from an impressive panel of experts about these issues and more. If you participated in one of our live events, you know this is similar to a radio talk show, and you have the opportunity to ask your questions live. For those of you joining us on the phone, if you'd like to ask a question about the coronavirus pandemic, press *3 on your telephone keypad to be connected with an AARP staff member who will note your name and question and place you in a queue to ask that question live. If you'd like to listen in Spanish, press *0 on your telephone keypad now.
Si usted desea escuchar en español, presione asterisco y 0 en su teléfono ahora.
If you're joining on Facebook or YouTube, you can post your questions in the comments section. Hello, if you're just joining, I'm Bill Walsh with AARP, and I want to welcome you to this important discussion on misinformation in the global coronavirus pandemic. We're talking with leading experts and taking your questions live. To ask your question, please press *3 on your telephone keypad, and if you're joining on Facebook or YouTube, you can post your question in the comments section. We have some outstanding guests joining us today, whom we'll introduce in a moment. This event is being recorded, and you can access the recording at aarp.org/coronavirus 24 hours after we wrap up. Again, to ask your question, please press *3 at any time on your telephone keypad to be connected with an AARP staff member. Or if you're joining on Facebook or YouTube, place your question in the comments. Now I'd like to welcome our guests. Joan Lunden is a journalist, best-selling author, and TV host. In 2020, she signed on as a MediaWise ambassador, a group of prominent journalists and media influencers who help promote the MediaWise mission, which is to empower people of all ages to be more critical consumers of content online. Joan also serves as one of the lead instructors for the MediaWise for Seniors Fact-Checking 101 online digital media literacy course. Welcome, Joan.
It's a pleasure to be here with all of you tonight. Thanks for asking me.
All right, we're delighted to have you. Also joining us is Dr. Lipi Roy. She is the medical director of COVID isolation and quarantine sites at Housing Works, a nonprofit organization in New York City. She's a Forbes contributor and a former MSNBC and NBC News medical contributor. Welcome to the program, Doctor. All right. Just a reminder, to ask your question, press *3 on your telephone keypad, or you can drop it in the comments section on Facebook or YouTube. Let's get started with the discussion. Joan, we're going to go ahead and start with you. We're bombarded every day with COVID-19 news and information, and it's difficult at times to differentiate reality versus rumors. So let me ask you, what is the difference between misinformation and disinformation? And why is this pandemic such a fertile ground for both of those?
You know, I think that it would all boil down to intent. Misinformation is just false information or maybe out of context information that almost gets shared by mistake. Think of your aunt or your uncle or your cousin or whoever. They see something that sounds so great, a miracle cure for COVID. And so with all good intentions, they want to share it with everybody they know on Facebook. But while they were well-meaning and maybe not even aware of the fact that they were sharing false information, they do it. But disinformation is a whole different thing. Disinformation is false information that is shared on purpose. And it's shared to sometimes, have a scam, when we saw, and a lot of people might have experienced some of these things that we're going to talk about tonight. At the beginning of the pandemic, scammers could come along with all these cures, of course, for your money. And then also when the vaccines started to roll out, there was a huge scam going on where they would trick people into giving personal information and sometimes their hard-earned money to get a better place in line, to get that vaccine because everyone was just so desirous of getting the vaccine. So all of this is made for really fertile ground. But then we also have the advent of technology and social media and algorithms and this, we've all been in our homes also. So you have that desire to connect with other people. You put this all together and it really is like the perfect storm because people are, they're dealing with something that's so unprecedented and so unknown that they're looking for something to make sense of it all. And sometimes they'll latch on to things that aren't real and they unknowingly, unwittingly share it with others.
Right. Well, thanks for that, Joan. A quick follow-up. I wonder if you could share some examples of pandemic-specific misinformation that has been harmful.
Oh my gosh, there's so many. When the COVID stimulus checks, they first came out, there were a lot of different ways that people were being scammed. I mean, just as an example, there was one that a used car dealership was sending out fake checks to people that could only, of course, be used at this one used car dealership. And it really got the people to engage. And then they convinced them to buy cars, thinking they were getting this amount of money off on the car. I mean, that's just kind of to give you an idea of how people have dreamed up all these different ways. But, the most important or the most harmful viral misinformation has really come from all these posts that have falsely claimed that people are dying. Thousands of people are dying from the vaccine. And that is simply not true. Sometimes these things come from a little seed of a report from somewhere. But they've been proven now definitively not to be true. But when people see that there are some people got blood clots with the J&J, for instance. 6 people out of 6 million people had these blood clots, which of course made everyone come to a pause with that vaccine. Now they've gone ahead with it. And by the way, all those 6 people did not die, but all it takes is something like that for that person wondering if they're going to go and get vaccinated to say, well, that's then they're all bad. And lately I've seen some about that the mRNA, that's how this virus is made, unlike the flu virus and some of the ones from the past. It's a really unique new way to do a vaccine. And there have been a lot of articles that can cause infertility. Well, I'm here to tell you that that's not true. Evidence is firmly shown that that is not the case. But that came about because I think it was a German epidemiologist last December, if I get this right. He came up with the theory that the COVID-19 vaccines might make a woman's body reject a little protein that's connected to the placenta. And therefore, his thought was that because that little genetic code of the placenta, that it shared a vague similarity to the spike in the protein on the COVID-19. And he said, well, if vaccines cause our bodies to create antibodies to protect us from COVID-19, his thought was that they could also make antibodies to reject the placenta. Now, you might be saying right now, well, that sounds ridiculous, but it was his theory, and he put it out there, and it's now been disproven. But in the meantime, people hear this and they latch onto it, and it gets shared over and over and over again. How about the one where there are microchips? No, wait, Bill Gates put the microchips into the vaccines, which, do I even need to try to defend that one? And one of the last ones that I've seen lately is that they have aluminum in them, and that this is going to harm us. Well, aluminum actually has been used in some other vaccines, and here's where, you see these stories. Not this one. It is not. You can go to the FDA website. You can look at all the ingredients in the Pfizer and in the Moderna. It's simply not in there, or any of the other crazy things that they say are in there. You can go and you can look. The facts are right there. And by the way, even the aluminum is not used in the amount that would harm us, even in those other vaccines, to all you anti-vacciners, because aluminum's in the earth.
Right.
So everything we eat comes from the earth, and we eat way more aluminum on a daily basis than is in any of those vaccines. Bottom line, though, there's no aluminum in the COVID-19 vaccine, in any of them.
All right. Well, thank you for that.
But it's not. The facts are there.
Yeah. Well, thank you for that, Joan. It's remarkable how these rumors get started and how they spread. And you touched on one I wanted to ask Dr. Roy about. Dr. Roy, a small number of voices, as Joan was referring to, continue to suggest that a high number of deaths have been caused by COVID-19 vaccines, more than 3,000 according to some. Is this true? Can you talk about this rumor?
So first of all, Bill, I just want to say this time I remember to unmute my microphone. And secondly, how many times have we said, that's like the saying for 2020, right? Can you unmute? And secondly, I would love to recruit Joan Lunden to the Housing Works medical team, because yesterday, I just gave a presentation to one of our clinics about vaccine misinformation and myths. And one of them is exactly what Joan just mentioned about women's fertility being linked to the vaccines. And what Joan was referring to, actually, it's called syncytin 1, which is similar to the spike protein on the coronavirus, but they're two very different proteins. So, and yes, it's involved with placental development. Anyway, thank you, Joan, for saying all of that. And to answer your question, Bill, that is yet another example of misinformation. These vaccines are incredibly safe. And just to take a step back for all your audience members, vaccines are medications that undergo the highest safety standards, more than any other medication that's in your medicine cabinet right now. And the reason for that is because vaccines are designed for healthy people, healthy children and adults. As a result, they have to undergo the highest safety standards. The vaccines have not been associated with deaths, and if anything, what they've been found to have is be not only safe but extremely effective. The mRNA vaccines, the Pfizer-BioNTech one and the Moderna one, are like 95% effective, and the J&J one is about anywhere from like 72 to 86%. 72 for the overall population and 86 for severe disease prevention or reduction in risk. So these vaccines are incredibly effective and safe. And the three things that they all equally do is reduce your severity, reduce your risk for severe disease, hospitalization, and death. That's ultimately what you want. And just as a reminder, Bill, let's remember COVID-19 pandemic is very much present here in the United States. We have mutants coming in from other countries that are already here, or mutant strains, I should say. And remember, this is a disease that has claimed over almost 590,000 lives in this country alone. It's a disease for which we have moderately effective treatment and certainly no cure, but we have effective prevention techniques. Masks, distancing, and now multiple vaccine candidates, Bill.
So, Dr. Roy, you just did a good job giving us some really great facts and figures about the vaccines. What is your best argument in favor of getting a vaccine to somebody who's still resistant?
I'm so glad you asked that, Bill. And this is a conversation that I have literally every day at Housing Works, at a harm reduction clinic where I work at the Bronx, and at vaccination sites where I work throughout New York City. Not only to my patients, the general public, but also to our staff. We have several healthcare workers who are nurses, medical assistants, nurse practitioners who still decline to get the vaccine. So what I really emphasize are that in human history, the most successful public health intervention has been vaccines. They have saved millions of lives. We right now in the 2000s are not really familiar with the fact that there was a time in history when infectious diseases killed the majority of people, and in certain parts of the world still do. So it's a miracle of science that we live in an age and in a location where we don't die from tetanus, diphtheria, polio, typhoid, influenza. Granted, these are all diseases that still kill people, but drastically low numbers because of vaccination and hygiene, clean water, things like that as well. So the key message is, Bill, the vaccines are safe, they're effective, and we really have no cure for this virus, this novel coronavirus, which we're still learning about every day, Bill.
Okay, Dr. Roy, thank you so much for that. Joan, let's turn back to you. How did decisions to delay or pause some of the vaccines, such as the Johnson & Johnson in the United States or the AstraZeneca in Europe, make it easier to spread misinformation? Are there examples of misinformation we might recognize?
I think we're living in a world of, see, I told you so. And everybody, because of algorithms, gets their own set of facts. We watch different newscasts depending on our, health or political beliefs. And when we Google things on our computers learn what we think. And by just what we've gone to over and over again, we each live in our own little silo of facts. And when somebody is concerned about getting the vaccine or is, believing some of these myths that are going around, when all of a sudden a vaccine gets put on pause, that's the I told you so moment, because they're looking for something to validate their belief. So, and, with this is an unprecedented health crisis. And it's the first time we've had a health crisis at the same time that we've had technology and social media. And you put those things together with the science constantly changing, it's difficult for the general public even just to keep up with, the latest news. And when they see a pause like that happen, and then they see it unpaused, it just leaves people in kind of a free fall. And, obviously, well, I say obviously, but the CDC and the FDA, they would not have carelessly put that back in use.
Sure.
And yet there are still people that are completely convinced that, that it's not safe to take it.
Who was it, Mark Twain, who said that a lie can make its way around the earth before the truth gets a chance to stand up out of its chair? I think that's only accelerated in the internet age, hasn't it? Well, it's now time to address some of your questions about vaccines, reality versus rumors with Joan Lunden and Dr. Lipi Roy. As a reminder, please press *3 at any time on your telephone keypad to be connected with an AARP staff member to share your question. I'd like now to bring in my AARP colleague, Jean Setzman, to help facilitate your calls and questions from Facebook and YouTube. Welcome, Jean.
Thanks so much, Bill. Delighted to be here for this important conversation.
All right. Who do we have first on the line?
The first caller is Matt from New York.
Hey, Matt. Welcome to the program. Go ahead with your question.
Okay. My question is this. We've heard of people who are vaccinated, such as 8 members of the New York Yankee baseball team and others who subsequently tested positive. And quite frankly, I don't trust the New York City or New York State government. Should I be tested despite the fact that I was vaccinated?
Dr. Roy, do you want to field that question?
Yeah, thank you so much for asking that. And yes, that has raised concerns among a lot of people. And as the caller pointed out, not only members of the New York Yankees, Bill Maher, many other celebrities, but many of my own patients have said, hey, doc, I don't want to get the vaccine because I heard that you can get vaccinated and still get COVID. So it's not that the scientists have lied. The CDC has not lied. They've been very clear in terms of what exactly the vaccine does. The vaccine significantly reduces asymptomatic infection and transmission. So in other words, your risk of getting COVID is significantly reduced once you're vaccinated. In addition, your risk of transmitting the virus to somebody else is also significantly reduced. But remember, no prevention measure in all of science and medicine is 100%. So you could get the vaccine and still test positive, which is why they're still recommending wearing a mask. And they're recommending that everyone else around you gets vaccinated because then their risk of getting the virus is significantly reduced. The key thing to remember is that you can, once you get vaccinated, if you still test positive, your risk of actually getting severe disease, hospitalization, or dying from the virus is significantly reduced, like about 85 to 95%, Bill.
Okay, thank you for that, Dr. Roy. Let's go back to the line. Gene, who do we have next?
Our next caller is Martha from Texas.
Hey, Martha, welcome to the program. Go ahead with your question.
Yes, hi. I heard the lady, I think it was Jean, said that 6 people caught had blood clots from the J&J vaccine, and all of them lived. I heard on the news that 1 died and 1 was on life support.
I believe that's correct. Joan, did you want to clarify that?
Yeah. I just said that they all did not die. 1 did die, and 1 is, I don't know if she's on life support, but I know she's in the hospital. But, you know, you have to look at population health, public health. You have to look at this globally, because we can do things here in this country, but if we don't help some of the other countries, this pandemic's not going to be over until we can control it all around the globe. And if you can't get in front of it, then it becomes something called an endemic. And, you know, this is new and unprecedented that we've ever had a virus this virulent. So when you're looking at a vaccine and you give it to 6 million people who are then vaccinated and they won't get sick and die, and you get 6 people who got blood clots and 4 of them weren't significant, you know, this is how, you know, once again, I think it was either the doctor or Bill just said that nothing is 100%, but the goal is to try to vaccinate globally. And by the way, if you drive a car, you're much more likely to get into an accident, a fatal accident, than taking one of these vaccines. If you fly, I mean, you can name 10 other things that you might do without ever thinking about them that is puts you much more at risk of dying than taking the vaccine. And doctor, you can please correct me if I'm incorrect, but I'm pretty sure I've got my facts straight there.
No, Joan, you're absolutely right. And let me just also clarify to Martha that since the as of like I think maybe yesterday, over 8 million doses of J&J have now been given worldwide, and there's maybe about 15 now cases, definitely like 15 to 20 cases of this rare blood clot. But just look at those numbers. 15 out of 8 million. I mean, there are medications that every day people take that increase their risk of getting a clot, like say oral contraceptive, where it's like 1 in 5,000. So I just want people to remember that these side effects are extremely rare. And look, your everyday Tylenol, which you take for pain and fever, it's the leading cause of acute liver failure. Ibuprofen can cause kidney failure and GI bleeding. So I just want people to remember, just put things into perspective.
Right. Well, thank you both for that. Gene, let's take another call.
Our next caller is Charlie from Delaware.
Hey, Charlie, welcome to the program. Go ahead with your question.
I had heard that in six months or in the fall, we've got to get a booster shot to keep these shots effective. Is that true?
That's a question we hear a lot. Dr. Roy, do you have an answer?
Well, Charlie, the short answer is we don't know. But it's looking that way, that we're probably going to need a booster shot. If you listen to Dr. Fauci on television, he's said multiple times that based on the data, again, we don't have very long-term data on any of these new vaccine candidates, but we may very well need a booster shot at either maybe 6 months or 1 year. But keep paying attention to the news and the data from the CDC and FDA. We'll find out soon enough.
You know, it strikes me, listening to the questions we've had so far, that there still is a lot of misinformation, a little uncertainty out there about who to believe, what sources to believe. I wonder if, Joan and Dr. Roy, you could very quickly give us some idea about how ordinary consumers are supposed to be able to verify some of the things that they're hearing.
Well, I think that's the reason why all the misinformation spreads so quickly, because people do have that desire. They want to know what's real. And unfortunately, we have had over the last year a breakdown in trust. And that's probably been, almost as well, the virus is the virus. But I mean, that's also been one of the things that has attacked us. The World Health Organization says we're not only dealing with an unprecedented pandemic, but we're also dealing with an unprecedented infodemic. And that really is, an excessive amount of information that's online and offline, but that's filled with all of the misinformation, and it breaks down people's trust in science and the media. And that's an incredibly dangerous thing at any time, but certainly during a pandemic, against a virulent virus. So I just think that it's going to take a while, I think. And, for me, having been in journalism for 40 years, I'm so saddened by that. And it's going to really, I think, take a lot to try to build back that trust. Right. But, Dr. Roy, I'm sure you'll add in here, trust in the science is so important in trying to accomplish public health.
Yeah, Bill, can I just add? So I love the sentiment that Joan just made. Since the start of this pandemic, which has now been well over a year, what has really troubled, frustrated, and frankly angered me and my fellow healthcare professionals, medical and public health professionals, is the fact that this disease, this infectious outbreak that does not discriminate, was politicized from day one, not just here in the United States, but other countries as well. And as a result, it has adversely affected life-saving therapies and interventions to, frankly, millions of people in the United States and worldwide. That's really unfortunate. Leadership matters. Leadership from our elected officials all the way down to our local community members. So I must say, I'm very glad to see that we are now, we have an administration that fully supports and listens to their scientific and medical advisors before making policy decisions. Because as a doctor, I'm just one person, but I can't do this work without the partnership and collaboration of organizations like AARP, like legendary journalists like Joan Lunden, sharing really evidence-based, life-saving information. And as for which organizations to follow and trust, the CDC right now, with the leadership of Dr. Rochelle Walensky, the FDA, but also look at the hospitals in your local cities. I used to work in Boston, so Mass General, Brigham, Boston Medical Center, University of Pittsburgh. I mean, there are many hospitals and academic medical centers throughout the country, as well as public health departments in cities and counties, which unfortunately have been underfunded for years. I'm hoping that will change. But trust those public health departments and academic medical centers as reliable sources of information. Bill.
All right. Thank you to you both. And let me shift the conversation to you, Joan. And here's where it gets a little bit hard. How do we talk to a family member or friend who's sharing information that seems questionable or blatantly spreads myths or bad information?
Well, first of all, let me just say that because your cousin or your brother or your mother or whoever shared something and you see it and like, what's going on? Remember first that the relationship is what's important, number one. Another thing that I think we could all not hear enough of you don't have to respond to everything online. So think before you do that. And the other thing is people have a tendency to say things online, typing it out with their fingers that they would never say in person to an individual. So even though you may have discovered this discrepancy online, have the conversation in person. First of all, take a deep breath, get your emotions in check. Usually this information is not being shared because someone is trying to do harm to someone else. They're trying to share something that they think is good information. Have the conversation in person or on the phone, or at least in some kind of a private message at the very least. And then remember how we did show and tell in school. We showed things as we told things. So don't just say, you're wrong because I say so. That's never going to fly. Find an article. And if you can, find an article or maybe with somebody that that relative of yours also respects and trusts. That will make it even better. And show them that. In other words, and if you know how to fact check, which we're going to teach you at some point here, if you sign up for the course, show them how to fact check. Show them how to do a reversed image check on a picture that they shared thinking it was real, and show them that it wasn't real. I mean, that way, first of all, you'll look really cool and smart, but also you'll be teaching them how to do something so that they will think first and fact check second before they share something again.
Right. Thanks for those tips, Joan. Dr. Roy, turning back to you, we've heard a lot about the mental health impact of the pandemic. How might misinformation contribute to the stress and fear and anxiety that people are feeling?
So I'm really glad you asked this question, Bill. It's so important. I'm actually working on an op-ed with a couple of my colleagues addressing the COVID's massive toll, mental health and psychological toll on India's doctors. As I think most of you know now, India has not been able to contain the pandemic there. So let me tackle this question about mental health in three ways. One is that vaccine misinformation will mean a segment of the population will decline vaccination and will be at risk for getting COVID, which can result in long-term symptoms, including brain fog and other long-term consequences that we still don't even know yet. So there's that aspect. Healthcare workers will continue to face the burden of caring for COVID patients, in addition to other patients with other illnesses such as heart disease and stroke and diabetes and kidney failure, motor vehicle accidents, which will exacerbate their burnout, fatigue, anxiety, depression. And remember, clinician burnout was an epidemic before COVID-19. And then last but most certainly not least, global anxiety over an ongoing pandemic. Businesses, schools, live entertainment, conferences, travel, etc., will they ever really fully reopen? This is going to lead to unemployment, housing, and food insecurity. All of that will result in ongoing anxiety. It's all connected, Bill. So again, I always wear my doctor's hat and public health advocate hat. Please get vaccinated. It is a life-saving measure. You'll not only be saving yourself, but you're going to be improving the health and livelihood of those around you, your loved ones, and just the rest of the community. We live in a world with other people. We always have, we always will. Bill.
Right. I like where you're going with the ripple effects of the pandemic. So I wanted to ask you a follow-up question along those lines. How have the challenges of the pandemic been revealed in our physical well-being?
Yes, I'm so glad you asked that. I love talking about these things. So first of all, again, I'm going to address that in three different ways. COVID infection, remember, this is not just a respiratory virus like, say, influenza. This particular virus causes multi-organ manifestations. People get myocarditis or heart illness, gastrointestinal, neurologic. So there's multiple medical or physical manifestations that way. And then just the stay-at-home measures of mitigation, working remotely, that has led to this lack of structure in our lives. And studies have shown that these stay-at-home measures have then led to an increase in sedentary behaviors, decrease in exercise. Remember, most gyms are closed. Poor eating habits, weight gain, especially amongst those with obesity. And then the third aspect is really pandemic-induced anxiety and uncertainty, which has led to difficulty with sleep and concentration, an increase in use in alcohol, tobacco, and other substances, as well as an increase in drug overdose. Drug overdose and opioid addiction, this was all an epidemic before the pandemic. And my day job is not only an internal medicine doctor, but I'm also an addiction medicine doctor. So these are topics and health issues that strongly resonate with me and for a lot of my patients, Bill.
You know, it seems in so many ways the pandemic is going to be lingering and with us for a long time, even once we move to herd immunity and vaccinations across the country. So thank you both for those comments. And as we said at the outset, in addition to misinformation, we've seen a proliferation of scams during the pandemic. Let's bring in Alex Mahadevan. Alex is a senior multimedia reporter at MediaWise. Welcome, Alex.
Great to be here.
All right. Thanks for being with us. I'd also like to bring in my AARP colleague, Amy Nofziger. Amy is the director of the AARP Fraud Helpline and is here to help us sort through some of the scams and how to avoid falling victim to one. Welcome, Amy.
Thanks for having me, Bill.
All right. Alex, let's start with you. A lot of these scams feel familiar. Why is that?
Well, they feel familiar because they are. Fraudsters they'll use the same types of misinformation to get your personal information or money as they would for really any emergency scenario. So, for example, down here where I am in Florida, I've seen the same tricks used when there's a hurricane that we're seeing now during COVID-19. See, the thing is, our emotions never change. Scammers can always use the same emotional hooks to get us sucked in. You know, surprise, elation, anger, disgust. These are all emotions you may feel when you come across misinformation that could be part of a scam. The bottom line is that unless you protect yourself, these scams work.
All right, Alex. Well, walk us through a few of the scams that you're seeing of late. And you mentioned the emotional hook. What is that hook, and what technique distinguishes, that so people know that they're being scammed?
So there are a lot out there. But first, the big one that I've seen is this fake vaccine survey. Now, this is when you might get an email, text message, or phone call from someone who may sound official, asking you to fill out a survey about getting vaccinated. And, if you do, you get a fancy new iPad Pro or some other prize. And all you have to do is pay shipping and handling. Well, the emotional hook is the surprise and elation you might have about getting a free iPad, right? And the tip-off that this is likely a scam is that they're asking for money up front for something you're supposed to receive. They just want you to trust them, which unfortunately these days is bad news. Next, there are a few scams going around about COVID-19 debt relief, as well as government grants that are supposed to make up for lost income or other COVID-19 effects. And these both appear to come from government sources, like the Treasury Department, but are scams. The emotional hook here is the relief you may feel knowing that you can slash some debt. But as always, you'll be asked to pay. They'll ask you to pay a processing fee. And, here's another tip-off is a lot of times they'll ask you to pay in gift cards. That is a major red flag. You see gift cards are a way for scammers to operate without getting caught. What's new about all these is you might see them on social media, on Facebook, and it might look like your friends are sharing links to these scams, but they're not actually your friends. They're fake profiles. It's a dangerous new world of misinformation out there online.
Well, thanks for all of that information, Alex. Amy, let me turn to you. How can someone stay up to date with the scams that are so quickly evolving, and how can they get some help?
Yeah, you're absolutely right, Bill. I mean, the scammers follow the headlines just like you and I do, and they are coming up with new ways every day to steal our hard-earned money. So one of the best ways is, like you said, to stay up to date. And the AARP Fraud Watch Network is a fantastic resource, and you do not need to be a member. We at the Fraud Watch Network believe that knowledge gives you the power over these scams. So certainly you can check out our website for all the latest information about the scams and frauds. And the great thing about the Fraud Watch Network is we have a toll-free helpline. This is what I do on a daily basis. I talk to victims and reporters every day about these scams. So when a scam comes into our helpline, and it's new and we need to warn people about it, we can quickly take that information and turn it around and give it to you. So we have some of the latest information. So please call us on the helpline. It's free. It's 877-908-3360 or visit our website at aarp.org/fraudwatchnetwork.
Okay, well, it's great, Amy, to know that there's help available. You know, Alex just ticked off a few scams that he's seen. Are there any others that we should be on the lookout for?
I mean, again, the scammers come up with new ones every single day. But bottom line, they want really two things from you. They want your personal information, like your social security number, Medicare number, bank account number, or they want money. So, right, it doesn't matter kind of what the scam is. If there's one of those two things involved with it, huge red flag. But I will tell you this, one of the biggest ones we've had over the last year are these government imposter scams, right? They'll call you and pretend to be either from the IRS or from the Social Security Administration saying that there's a problem with your account or that you didn't pay your taxes. They'll bring COVID into it somehow, saying, well, we need you to pay immediately because of COVID restrictions. We can't have you come down to the office. And again, just like Alex said, they're going to ask for payment in these non-traditional ways. Prepaid gift cards are a preferred method because they're virtually untraceable and they're so accessible to everybody. I mean, you walk into a pharmacy or a grocery store and you see those huge carousels of those gift cards. So if anyone calls you asking for a gift card or saying you're in trouble with the government, hang up the phone. It is not them.
Great advice, Amy. Thanks so much. I mean, it sounds like the scammers never rest. Alex and Amy, I wonder, what's your best advice for our viewers and our listeners on how to spot and avoid misinformation scams?
So I will say, first off, use your gut. If you get an emotional feeling when you see a post online or you get a call or text, that's a major red flag. Stop before engaging or sharing. I might have a slide coming up here, but it always look for official government sources. For scams, you can trust and look into the Federal Trade Commission or the Consumer Financial Protection Bureau. And for anything really COVID-19 health related, you want to stick with the CDC and FDA. And also, everything we talked about today, all this research, you can use a technique that we at MediaWise call lateral reading. And this is when you open a new tab, search for more information, open another new tab, search for even more information, and just go deeper and deeper to find out more about the potential scam you might be falling victim to.
Amy, any advice?
Yeah, I'm so glad that Alex brought up the gut, because sometimes I say that and people look at me like, you're crazy, but it's true. Listen to your gut. And I've talked to so many victims in my 19 years at AARP, and they say, I should have listened to my gut. So that is a huge red flag. If your gut is telling you something's off, listen to it. Also, if someone is making a guarantee, whether it's on an investment or we heard a lot of these COVID-19 cures, this guarantees you not to get it. Huge red flag. Nobody can guarantee anything like that. And then finally, big red flag when they ask for a non-traditional form of payment. We mentioned prepaid gift cards earlier, but we're also hearing about a lot of requests for cryptocurrency, right? And a lot of people don't know how easy it is to access it. There are machines at your local grocery stores that look like ATM machines, but it's actually places for you to buy cryptocurrency. And again, that's an untraceable form of money, and scammers want that. And then finally, there are these things called peer-to-peer apps. Common names are Cash App, Venmo, and Zelle. If anybody that you do not know wants you to pay in that method, it's a scam. That's for friends and family only.
All right. Alex and Amy, thank you so much. Great tips, and it's great to know that there's some tools and resources out there to help. Now it's time to address more of your questions with our guests, Joan Lunden, Dr. Roy, and Alex Mahadevan. As a reminder, please press *3 at any time on your telephone keypad to be connected with an AARP staff member, or if you're watching on Facebook or YouTube, just drop your question in the comments section. Gene, who do we have on the line next?
Our first caller is Nancy from South Carolina.
Hey, Nancy, welcome to the program. Go ahead with your question.
Yes, sorry about that. I was listening. My question is that I've heard, in fact, from people in New York, that this vaccination has things in it that's supposed to kill people the end of this year or next year. And I don't know, other than they're saying the items that are put into the vaccination is what's going to cause people's deaths. So that's a big one that just came out that I heard in the last couple of weeks. So maybe.
Well, let me have some of our experts address that. I know, Joan, you talked about this a little bit earlier. Do you want to address that at a little more length?
You can go to the FDA website. I mean, that's where the buck stops there as far as what's in any particular drug, and go to it and go to either the Pfizer vaccine or the Moderna, whatever vaccine, and it lists the ingredients right there. And I mean, maybe Alex wants to address how you then do your fact checking, but a lot of these things that are being put out there, the male part of the placenta, and I mean, there's all these crazy things. Those are not in the ingredients. I mean, all you have to do is go and look, and they're not in the ingredients. So, this is the kind, they put doubt into your mind.
Sure.
That's the problem. They just put that little bit of doubt into your mind so that you won't go and get vaccinated. And it's not in your best interest, and it's certainly not in the public's best interest that we don't reach herd immunity, and that we don't want this to become an endemic where we live with it forever. We all need to get vaccinated.
Alex, I'd like to have you weigh in on this. People are busy. They don't have a whole day. It's not their job like it is for you to track these things down. Give me some sources people can use if they're hearing some of these allegations.
Well, I can tell you that fact checkers have been working overtime for the last more than a year, personally, and my friends and colleagues. So a lot, I would say almost any claim that you hear from friends or family, like that one about ingredients that might kill you, have been fact checked. So the quickest way to find it out is to do what I call lateral reading, which is look at that post that you're seeing and open up a new tab and then start using keywords to find out more about that source or post. And you're most likely going to come up with a fact check from whether it's PolitiFact or the Washington Post fact checker. Reuters has a great fact checking arm. Basically, every major news outlet does major fact checking now. So that's a quick way. It takes a couple of seconds to Google it and maybe a couple minutes to read the article. So that's what I would suggest.
All right. Thanks, Alex. Gene, who is our next caller?
Our next caller is Kurt from Pennsylvania.
Hey, Kurt, welcome to the program. Go ahead with your question. Hey, Kurt, go ahead with your question.
About taking pain medications and getting the vaccine.
What's your question, Kurt?
I heard that if you're taking certain pain medications like oxycodone or diazepam, that there might be some kind of something might happen.
Dr. Roy, do you want to weigh in on this? I mean, there has been a lot of talk about what you should take and what you shouldn't take after vaccine if you're having some side effects. Dr. Roy, are you on mute?
So sorry about that. So Kurt, thank you for asking that question. You know, there's actually a very short list of who cannot get the vaccine. Really, people who have a history of like anaphylaxis or severe allergic reaction to other vaccines or other medications, well, really mostly other vaccines, including dose 1 of, say, Pfizer or Moderna. As for medications, I really can't think of any medications that can really clash or cross-react with any of these vaccines. That said, if you're somebody who's immunosuppressed and you're on certain chemotherapies or other medications that may suppress your immune system, by all means, talk to your doctor before you get the vaccine. But people who are immunocompromised or immunosuppressed should really also be getting the vaccine. But if you're concerned about any of your pre-existing medications or pre-existing conditions, always talk to your doctor, your healthcare provider first. But really, no medication should be a contraindication for getting any of these vaccines.
Okay, Dr. Roy, thank you very much. Jean, who do we have next on the line?
Our next caller is Wanda from Ohio.
Hey, Wanda, welcome to the show. What's your question?
My question is, I had brown hair when I was a kid, and then I got white hair, and then I got the doctor told me to get my vaccine, get my shots. I did. And now my hair in the back is growing brown. So I'm hoping it turns brown, all of it. And if the shots did that to me, I would like to know. If it does, and my hair will all turn brown, I'll be tickled. But
well, have you had any other side effects from the vaccine?
No.
Just a change in hair color. Well, you may be one of the blessed. Let me ask Dr. Roy to address that question.
Well, first of all, Wanda, damn, I know tons of friends who would kill to have that kind of a side effect. There's been several side effects that have been associated with the vaccines. A change in hair color is not one that I'm familiar with, but frankly, some of the most common ones and ones that I've experienced after getting the vaccine, really it's fatigue, a headache, chills, body aches, nausea. Those are really the most common. It's rare for somebody to get all of those side effects. And there are some people that get no side effects. But a change in hair color is not one that I'm familiar with, Wanda.
All right. We'll add it to the list. Jean, who is next on the line?
Our next caller is Monita from Indiana.
Hey, Monita. Welcome to the program. Go ahead with your question.
My question is, I've heard two different stories. I've heard that you can only catch the COVID by touching things that other people have touched, and others say that you can only catch it by the air. What's the truth?
Dr. Roy, I think there has been actually some guidance around the COVID vaccine lingering on surfaces. Can you shed some light on that question?
Yeah, we now actually, so first of all, Manita, thank you for asking that question. We now have like over a year's worth of data, which may not seem that much, but it's more than what we had like a year ago. So actually, studies have shown that transmission from surfaces is really not that common or high mode of transmission. Manita, the thing to remember is that this coronavirus, the way that it transmits is through respiratory droplets and that are in your nose or nasopharynx and in your mouth. So that's why wearing that mask covering your nose and mouth was so life-saving, and it still is life-saving. This virus transmits from person to person from respiratory droplets. But the vaccine can decrease that transmission from your mouth and nose to other people. So that's why getting that vaccine is so important. But also hand hygiene and distancing along with the masking and the vaccines are other highly effective measures as well.
Okay, Dr. Roy, thank you so much for that. Jean, who do we have next on the line?
Next caller is James from Michigan.
Hey, James, welcome to the program. Go ahead with your question.
Yeah, I think that most people, at least that I know, will trust, a question of trust, will trust their family doctor. But the family doctor is overwhelmed with 300 patients, and so you can't get to your family doctor. Is there a way that family doctors can be reached and can help with the trust problem?
It's a great point, and I think throughout the pandemic, trust in physicians has probably only gone up. Dr. Roy, I wonder if you can answer the question directly, and maybe Joan weigh in on it on other sources that we can trust.
The caller, James, thank you. I feel your frustration, my friend. This is something that many patients and many people in the public experience, which is an inability to reach their doctors on time. Clinics are well aware of this. As I said earlier, burnout amongst healthcare workers was an epidemic before the COVID-19 pandemic. So look, if you're unable to reach your family doctor, that's okay. There's many other sources of reliable information. We've already talked about several just on this program. The AARP is a great example, a great resource. The CDC, the Mayo Clinic, Massachusetts General Hospital, NYU, the hospital or academic center in your local area, the public health department in your area. But just going to Googling CDC and whatever your question is, your answer will be your question will be answered in a reliable and accurate manner, James.
Joan, I wonder if you could just weigh in on some go-to trustworthy sources at this critical time.
Well, interestingly, there's a couple of things that I thought were important to bring up. Number one, telemedicine is something it's funny because a year ago I did a podcast for the Washington Post and Cleveland Clinic, and one of our shows was about the emergence of telemedicine, which they expected to maybe roll out over a 5 to 10 year period. And of course, the pandemic hit and it rolled out overnight. And so that is really, and it's most of the doctors are making themselves available through telemedicine. But the big concern is that if you have a disconnect with your doctor, and so many people have had a disconnect from their annual checkups. Women didn't get mammograms. Women haven't been getting them for, 3-4 months. The clinics were just downright closed. And then they've opened up it, but there's been such a backlog from all the people who couldn't get in for those 4 months or so. And physicians that I talk to, whether they're, cancer physicians or primary care physicians, they're really worried that a lot of people will have missed during this 14-month period where they haven't been able to go to the doctor or then have been reluctant to go into a doctor's office and have eventually kind of become just disconnected from their health routine, that we are going to miss a lot of diagnoses. And we're going to miss early diagnosis, which for many, many different chronic illnesses can make the difference in a person's prognosis. So everybody that's listening, if you didn't get your colonoscopy, if you didn't get your mammogram or any of these, and if you haven't been in for your annual checkup and get a CBC while you're doing that, call the doctor and make an appointment. And if you can't get it for a few months, just go ahead and take it for that. It's that, before you know it, that time will come up. And we all have to be our own advocate. We all have to be the CEO in charge of our own health care, because, it's not like the old days where there was one doctor that was a family doctor and he knew everything about your health risk. We all see a multitude of doctors. They're not talking to each other. So you've got to be the gatekeeper. Yep. Right. And if there's one thing we can try to impress upon everybody here, it's don't let this pandemic stop you from getting all the checkups that you need.
Right. Well, that sounds like a terrific way to close us out, Joan. I wonder if Alex and Dr. Roy have any other recommendations for our listeners and our viewers. Dr. Roy?
Well, first of all, I'm so glad that AARP is put on this event. Health, with this pandemic, has really reinforced the idea that without your health, you have nothing, right? This pandemic has shown us that this one virus just dominated the world, stopped the world in its tracks. And as a reminder, the United States tends to invest money in things like, say, the military, in financial sector, but it doesn't invest as much in the leading causes of death, which are heart disease, diabetes, cancer, lung disease, pneumonia, Alzheimer's are all in the top 10. We need to invest in public health and in health from your local, state, and federal health agencies. And we just need to take care of one another, Bill.
Okay, thank you so much for that. Alex, any closing thoughts or recommendations?
Well, I do want to thank you for letting me be here and talk about a really important topic. And, misinformation around the COVID-19 pandemic is near and dear to my heart as someone who's been following this for the last more than a year. I'll just say nobody likes to be misled online, whether it's to share a miracle cure or bad information about vaccines or scams. So try to be your own fact checker. Trust your gut when you see something online. But overall, this is what I try to tell people all the time is be kind to yourself and be kind to others. There's a lot of terrible stuff online. Misinformation is a part of it, but just try to be kind to each other.
All right. Thank you, Alex. And Joan, I think you want to talk a little bit about a MediaWise opportunity for those who've tuned in tonight.
I sure do. MediaWise is offering a free fact-checking online course. I really encourage you to do this for all the AARP members. So I'm going to tell you how to go to it. You can register at https://poy.nu/AARP. And AARP has to be all big letters. So once again, https://poy.nu/AARP, all in caps. I highly recommend that you do this. You're going to learn so much, and you're going to be empowered as to how you take in all your information online, wherever you get all your information.
All right, Joan. Well, we got some great information from our experts here tonight. Thank you all. This has been a really informative discussion, and I appreciate all of our experts for answering our questions. And I want to thank you also, our AARP members, volunteers, listeners, and viewers for participating in this discussion. AARP, a nonprofit, nonpartisan member organization, has been working to promote the health and well-being of older Americans for more than 60 years. In the face of this crisis, we're providing information and resources to help older adults and those caring for them protect themselves from the virus, prevent its spread to others, while taking care of themselves. All of the resources referenced here, including a recording of this evening's Q&A event, can be found at aarp.org/coronavirus, beginning May 21st, tomorrow. Again, that web address is aarp.org/coronavirus. Go there if your question was not addressed, and you will find the latest updates, as well as information created specifically for older adults and family caregivers. We hope you learned something that can keep you and your loved ones healthy, and help you identify the reality versus rumors when it comes to the coronavirus vaccine. Please tune in June 3rd at 1 p.m. Eastern Time for another live event answering your questions about the coronavirus. Thank you and have a good evening. This concludes our event.